engaging in personalities towards the President. Under the Speaker's announced policy of January 6, 2015, the gentleman from Virginia, Mr. Scott, is recognized for 60 minutes as the designee of the Minority Leader.
Thank you, Mr. Speaker, and I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include extraneous material on the subject of the special order.
Without objection.
Mr. Speaker, more than 60 years ago, Congress responded to the Defense Department's concern that so many children were malnourished that they were unfit for military service by passing the National School Lunch Act as a measure of national security to safeguard the health and well-being of our nation's children. Through the enactment of the first federal child nutrition program, Congress recognized that feeding hungry children is not just a moral imperative, but it is vital to the health and security of our nation. Mr. Chairman, I serve as a ranking member of the House Committee on Education and the Workforce, and our committee is tasked with making sure that all children have an equal shot at success, so it's only fitting that child nutrition programs fall within our committee's jurisdiction. Just as there is a federal role in ensuring that all children have access to quality education regardless of where they live, what they look like, or their family's income, there is also a federal role in ensuring that every child has access to healthy and nutritious food. Research has repeatedly shown us that lack of adequate consumption of specific foods, especially fruits and vegetables, that the lack of consumption is associated with lower grades among students. And child obesity affects all aspects of a child's life, from the physical well-being to their academic success and self-confidence. So we have a choice to make. We can put money into these programs now and support healthy eating in schools, or we can cut corners and spend more money down the road on chronic diseases and other social services, putting the well-being of our children and our nation's future at risk. But either way, we will spend the money. In fact, researchers estimate that $19,000 is the incremental lifetime medical cost of an obese child relative to the normal weight child who maintains that normal weight throughout adulthood. And so it's important to keep this trade-off in mind as we talk about reauthorization of child nutrition programs. The hallmark of a good reauthorization is that it makes progress. It moves us forward. It builds on what works and improves on what needs to be improved. So with this in mind, Democrats are ready to make improvements to the child nutrition programs and to protect the progress that has been made. For example, we've made progress in creating healthier school environment for students. The nutrition standards enacted in the 2010 bipartisan reauthorization, the nutrition standards are working. Around 99% of all schools are meeting the standards. Kids are eating better food. Studies show that kids are eating up to 16% more vegetables and 23% more fruit at lunch. Now, unfortunately, many are now advocating that we roll back the standards, and the Republican draft bill released last week makes numerous steps backwards by making less nutritious foods available in schools. Another example of progress is the community eligibility provision. Enacted in the 2010 reauthorization, the Community Eligibility Provision, or CEP, allows schools to provide free, nutritious meals to all students without using the paper applications when a large portion of the students are deemed eligible because they're already receiving certain social benefits. Schools love this, teachers love this, families love it, and kids love it, so why go backwards? Again, unfortunately, the Republican bill does just that by making it harder for schools to use CEP, kicking thousands of schools out of CEP and back into the individualized paper application process. So we're talking about a hugely popular option for schools that improves the health of children, makes everyone's job easier. If it ain't broke, don't fix it. If it ain't broke, you shouldn't make a special effort to try to break it. Now, our work on reauthorization of our school nutrition programs represents a great opportunity to continue to change the way children eat, to expand their access to nutritious meals, and to end the child hunger crisis in our nation. So we should ask ourselves if these are goals that we're willing to compromise, or whether we will continue on that path that has resulted in healthier schools and communities. The success of these programs are too many to mention, but it's my hope that we will continue to build on our success and invest in the future of our country. At this time, I yield to my friend from Ohio, the ranking member on the subcommittee on childhood education, childhood, elementary, and secondary education, Ms. Fudge.
I thank the gentleman for yielding, and I thank you. Mr. Speaker, more than 21% of American children live in poverty. More than 15 million children live in food-insecure households. In fact, households with children are more likely to be food insecure than those without. In my home state of Ohio, 16.9% of households experience food insecurity, and Ohio's rate is higher than the national average of 14.3%. Programs that affect child nutrition, such as National School Lunch Program, the National School Breakfast Program, and the Summer Food Service Program, are essential tools in the fight to end child hunger. Access to healthy foods during the school day and throughout summer feeding programs is essential to helping children thrive both academically and developmentally. The Improving Child Nutrition and Education Act would increase the burden on schools with new verification requirements and increased community eligibility thresholds, or CEP. I represent one of the nation's most impoverished districts, with nearly 200,000 people living in poverty. Out of 435 districts and the District of Columbia, my district ranks 420th. Only 16 other districts in the United States fare worse than mine. If passed, the changes to CEP alone could result in children across the country losing access to free and reduced price meals at school, and that is unacceptable, Mr. Speaker. The bill fails to make critical investments in the summer meal program. Meals served through the summer feeding program may be the only one some children have in a day. If the sponsors of the bill truly wanted to improve child nutrition, they would invest in summer meals to ensure eligible children do not go hungry during the summer months. As we move towards reauthorization, we must strengthen and expand child nutrition programs. Our children's health and education are not budget-saving gimmicks. I firmly believe that any attempt to reauthorize child nutrition programs must improve access to healthy foods year-round. This bill does not even come close to meeting the minimum requirement. We must engage in bipartisan conversations about how to best meet the needs of all children. And I thank again the gentleman for yielding.
Thank you, and I thank you for your comments. Mr. Speaker, I now yield to a hard-working member of the Committee on Education and Workforce, the gentleman from California, Mr. DeSaulnier.
Thank you, Mr. Scott. It's a pleasure to rise in support of my colleagues in urging the reauthorization of this act based on nutritional value and investment in this country's future and our young people. And specifically, I want to take a minute to talk about the simultaneous issues of extreme hunger and obesity in this country and in my home state of California, which are nothing short of staggering. 14% of people in California are food insecure. 23% of California children are insecure. And in my district, 14% of the total population is food insecure. In the United States, 3 out of 4 public school teachers tell us that students regularly come to class hungry. 81% say it happens at least once a week. Over 15 million American kids struggle with hunger. On the other hand, American kids who eat school breakfast miss less school, get better grades, and are more likely to graduate from high school. At the same time, there is a childhood obesity epidemic in this country. Childhood obesity has more than doubled in children and quadrupled in adolescents in the past 30 years, according to the Center for Disease Control. In 2012, more than 1/3 of children and adolescents were overweight or obese. 1 in 3 children in California are currently overweight or obese, according to the Pew Endowment Foundation. Research shows that children living in states with strong school nutrition standards are more likely to maintain healthier weights. The estimated annual health cost of obesity-related illness in the U.S. is a staggering $190.2 billion, or nearly 21% of annual medical spending in the United States. Childhood obesity alone is responsible for $14 billion in direct medical costs. Ironically, the federal government spends $15 billion every year in school food. The work that we began with the Healthy, Hungry, Free Kids Act in 2010 is having an important and positive effect on both of these problems at once. School meal participants are less likely to have nutrient inadequacies and are more likely to consume fruit, vegetables, and milk at breakfast and lunch. Low-income students who eat both school breakfast and lunch have significantly better overall diet quality than low-income students who do not eat school meals. The school meal nutrition standards are having a positive impact on student food selection and consumption, especially for fruits and vegetables. Few packed lunches and snacks brought from home meet National School Lunch Program standards and Child and Adult Care Food Program standards. Children in after-school programs consume more calories, more salty foods, and sugary foods on days that they bring their own snacks than on days they only eat the after-school and snack provided by the National School Lunch Program. In California, I'm pleased to say that we've figured it out. We've figured it out for the kids, for their parents, for the purveyors who provide all of this healthy product, and for the school administrators and rank and file staff who distribute these foods. Over 93% of school districts nationwide have met the improved lunch and breakfast standards, certifying them to receive federally authorized school lunch reimbursement rate increases. In California, we exceed the national compliance rates with 100% of our schools currently in compliance. These standards are going a long way towards decreasing the health costs associated with malnutrition for both hungry and obese children. We must double down on these efforts, not turn away from them. Our children deserve at least this much from us, and I look forward to working with my colleagues on this effort. And I yield back the balance of my time.
Thank you. Mr. Speaker, I now want to yield to a strong child advocate, the gentlelady from Wisconsin, Ms. Moore.
How much time?
Is that time you're making some?
Thank you. Thank you, Mr. Scott, and thank you for recognizing me. I'm really pleased to join the ranking member, Bobby Scott, a mentor of mine and a good friend, and Marcia Fudge and others about the reauthorization of school meals and the WIC program. They are truly champions for ending hunger among children in this country. And I believe no conversation could occur about hunger without having the indomitable Mr. McGovern with us this evening. You know, the child nutrition reauthorization is really a critical opportunity for us to talk about the importance of improving access to healthy meals in schools and for maintaining strong nutrition standards. For too many kids, Mr. Speaker, the only sure meals that they can count on any given day are provided in school. And yet, Mr. Speaker, unfortunately, the majority on the other side of the aisle are talking about how to make it harder for children, especially low-income children who are eligible for free and reduced price meals, breakfast and lunch, to access these programs. We should be using this reauthorization to address known gaps and to help children connect to these healthy meals. Nearly 10,000 more schools offer school lunch than offer school breakfast programs, and we should be trying to expand school breakfast rather than restricting them. The Healthy Hunger Free Act and the nationwide implementation of the community eligibility program was so insightful, but yet we need to do more. Over 162,000 kids in my state qualify for free or reduced meals for lunch. And we need to reach them. Now, what does the reauthorization that Republicans are bringing before us entail? What does it talk about? It talks about scaling back the successful and proven community eligibility provision, which we just implemented nationwide last year and really haven't scaled it up to what it could be. This innovative program actually works. We've proven it. We have metrics that prove that the program increases access and participation for low-income students, and it helps to reduce administrative burdens and costs for school staff. Now, Mr. Speaker, you've heard my colleagues here talk about obesity. Now, obesity is not just a cosmetic problem. It is a major health problem. And we also last year put new nutrition standards in to ward off obesity. And 97% of the schools have successfully met these new standards. And USDA has shown great eagerness to work with those who have not. And of course, these new requirements you require more servings of fruits, vegetables, whole grains, fat-free and low-fat fluid milk in schools, while cutting sodium-saturated fat and trans fats. And Mr. Speaker, I can tell you that when you introduce these foods to children at a young age, they will start to prefer them, and we can really transform their lives. I want to skip over many of my comments and just add them to the record, because I just want to focus on one little disease that's associated with poor nutrition, and that's diabetes. The burden to individuals and families is gargantuan. You hear of people losing their limbs because of diabetes. But Mr. Speaker, I want to talk about the burden to the economy and to the budget by allowing diabetes to run amok. Diabetes is a budget-busting disease. It's an epidemic that's affecting an increasing number of Americans, including more and more of our youth. Right now in 2014, 29 million people in the United States, 9.3% of our population had diabetes. That's about 1 in 11 people. According to the CDC, by 2050, that number could be as high as 100 million, or 1 in 3 persons. The time to stop this is now, while we're reauthorizing the child nutrition bill, and we can help our children develop healthy eating habits. I've seen kids love avocados, love grapes, love these things that are introduced to them while they're young. And our investment in school lunch and school breakfast pales in comparison to the cost of treating diabetes. In 2012, diabetes and its related complications accounted for $245 billion in total costs. Now, that's $176 billion in direct medical costs, think Medicaid, Medicare, and lost wages and work. And the CDC estimates that the growth in these, if their predictions hold, if we don't do something, just think, this will go from 1 in 11 people having diabetes to 1 in 3. So we're looking at 2050, 2050, I don't think I'm going to be around in 2050. This is clearly a clarion call to feed our children properly now. In fiscal year 2016, we spent $12.5 billion on the school lunch program and $4.3 billion on the school breakfast program. Compare that with the $245 billion that we spent on diabetes for just 1 year. And so with that, I will add the rest of my comments to the record. But I would just say, Mr. Scott and Mr. Speaker, that school breakfast, school lunch, WIC, it's a doggone good deal when you think about it.
Thank you, and you're absolutely right. Mr. Speaker, I want to yield now to one of our strongest advocates for ending hunger in America, the gentleman from Massachusetts, Mr. McGovern.
Thank you very much. I want to thank my colleague from Virginia, Mr. Scott, for organizing this today and for his leadership on child nutrition programs. I want to thank all my colleagues for being here. This is an important issue. There's no question about that. But we are here because we are outraged. We're outraged at Republican attempts to undermine our child nutrition programs. We're outraged at their lousy child reauthorization bill. It is a terrible, terrible, terrible bill. My friends should be ashamed of this bill. Mr. Speaker, a nutritious school meal is just as important to a child's success in school as a textbook. Hungry children can't concentrate. They can't focus on their studies. In short, hungry children cannot learn. That is a fact. Everybody knows that. And yet we have a bill that my Republican friends have drafted that will increase hunger, that will actually take food out of the mouths of children. It is outrageous. Together, our child nutrition programs, WIC, school breakfast and lunch, the summer food service program, and the child and adult care food program provide nutritional support for children year-round in places where they live, learn, and play. Unfortunately, H.R. 5003, which is the Republican reauthorization bill, includes a number of harmful provisions that would roll back years of progress and hamper the ability of children to access healthy meals. As I said, to be very blunt, it makes hunger worse in this country. Specifically, the bill would undermine the successful community eligibility provision, which some of my colleagues have talked about, first included in the last reauthorization bill, that has allowed high-poverty school districts to offer universal school meals to all students. In its first 2 years, CEP helped more than 8.5 million low-income students access free meals. Instead of building on the success of this program, my Republican friends would severely restrict schools' eligibility for the community eligibility option. The Center on Budget and Policy Priorities estimates that 7,022 schools currently using community eligibility would lose it under this Republican bill, and another 11,647 schools that qualify for community eligibility but who have not yet adopted it would be prevented from doing so in the future. And as we approach the summer months, it's also important to remember that child hunger gets worse in the summer. Consider this: for every 6 children who get a lunch at school each day, only 1 receives a meal in the summertime. Instead of being a carefree time for children who depend on getting healthy, reliable meals during the school year, the summer months can be a time of stress and anxiety and hunger. But it doesn't have to be this way. Unfortunately, this Republican bill cuts the successful summer EBT pilot program, which provides a temporary boost in food assistance benefits during the summer months for families whose children receive free school meals during the school year. And it fails to make necessary investments to expand the reach of summer food service programs so that more kids have access to healthy summer meals in their neighborhoods. In addition, Mr. Speaker, this bill rolls back, as my colleagues have mentioned, evidence-based standards that make school meals healthier. USDA estimates that more than 90% of schools have successfully implemented these standards. My grandmother used to say to me when I was growing up, "An apple a day keeps the doctor away." I wish she was still alive so I could tell her she was right. Food is medicine. When we eat good food, we eat nutritious food, we tend to have healthy lives. If you eat bad food, if you eat junk food, then you end up getting health issues like diabetes, like high blood pressure, like obesity, and I could go on and on and on. Why in the world would anybody want to lower the nutrition standards in our school meals to give our kids junkier, less nutritious food? What sense does that make? And if my colleagues who are advocating these reversals of smart policy are doing so only because they want to save a few dollars, let me tell you something: you're saving nothing. You know, if we don't get this right, if we don't insist that our kids have access to more nutritious, healthier food, the medical costs associated with the health challenges that they will experience are astronomical. As my colleague from Wisconsin mentioned earlier, hundreds of billions of dollars in avoidable health care costs as a result of children not having access to good food. Mr. Speaker, 15 million children face hunger in this country. And instead of undoing the success we have already achieved, Congress should be focused on ways we can strengthen these vital child nutrition programs. Mr. Speaker, let me just say finally, it is hard for me to understand why we have to be here today, why everything is a fight when it comes to dealing with issues of hunger, when it comes to dealing with issues of making sure our kids get access to good nutrition. It's always a fight. It is always a fight to protect so many vital food and nutrition programs that help our kids. There is either a shocking ignorance about the reality of the poverty that millions of our children face in this country, or there is simply indifference. Those are the only two ways I can explain what is going on in this chamber. And whichever one it is a sad excuse for what my Republican friends are trying to do. Let's come together. This should be a bipartisan issue. There was a time when fighting hunger, when making sure that our kids had access to nutritious food was a bipartisan issue. You know, George McGovern and Bob Dole worked together in the 1970s to strengthen our food and nutrition programs. But now, in this chamber, these issues have become controversial. And it is sad, because there are a lot of people in this country who are depending on us to find ways to end hunger in America. They're depending on us to make sure that their kids, when they go to school, have access to nutritious food, and that they have access to nutritious food during the summer months as well. Why are my friends making it so difficult? Enough. Enough of this. Stop beating up on the most vulnerable people in this country. Let's come together. Let's reject this awful draft of the Child Nutrition Reauthorization Bill. Let's come together and do this right. It's the least we can do. And with that, I yield back my time.
Thank you, and I thank you for all of your advocacy on ending hunger. Thank you very much. And, Mr. Speaker, I now yield to an effective member of the Committee on Education and Workforce, a gentleman from California, Mr. Takano.
Thank you, Mr. Ranking Member. I appreciate the time allotted. Mr. Speaker, in my 24 years as a public school teacher, I learned a lot about helping students reach their potential. I learned about project-based learning and STEM education. I learned about the importance of arts and music in keeping students engaged and excited. But I also learned that there is no lesson plan or study guide that can improve a student's performance if they are hungry. Good nutrition is the foundation to a good education. And with that experience in mind, I rise to express my frustration and sadness with the Republicans' proposal for reauthorizing the so-called Improving Child Nutrition and Education Act. The draft bill published last week includes several provisions that would restrict students' access to nutritious food, particularly children in America's poorest neighborhoods. The proposal undermines nutritional standards for schools, despite those standards receiving overwhelming support from pediatricians and public health officials. It weakens a popular program designed to give poor students access to fresh fruits and vegetables in communities where they are scarce. And it increases the burden on poor families to prove that their children are eligible for lunch programs. But the impact of these provisions is mild compared to what Republicans are proposing to do with CEP, or the Community Eligibility Provision. CEP streamlines national school breakfast and lunch programs by automatically enrolling students who live in areas with high rates of poverty. It was passed with bipartisan support just 6 years ago, and it is responsible for feeding more than 3 million students every year. Now Republicans are seeking to change the CEP formula to kick many poor communities out of the program. Their goal is to save money by allowing fewer students to enroll in breakfast and lunch programs. Not only is this bad policy that will hurt student performance in low-income schools, it is cruel. In my district alone, this would affect more than 6,000 students. Nationwide, it will severely damage a program that is critical to both fighting child poverty and closing the achievement gap in education. There is a troubling asymmetry to conservatives' approach to spending. When it comes to tax cuts for large businesses that cost this country billions of dollars, conservatives are generous with taxpayer money. But when it comes to hungry students in America's poorest communities, that's when it's time to cut back. That's when it's time to be stingy. That's when they turn their backs on people in need. Earlier this week, Speaker Ryan said that conservatism is just a happy way of life. This brand of conservatism is not a happy way of life for thousands of hungry children who will lose access to food at school. It is not a happy life for the parents of those children who are struggling every day to provide for them. And is not a happy life for the generation of students who do not have the foundation to reach their potential. Who could be happy when so many Americans are suffering? Thank you, and I yield back, Mr. Ranking Member.
Thank you, Mr. Takano, and thank you for your leadership on the committee. Mr. Speaker, I now yield to the leader of the Democratic Whip's Task Force on Poverty, Income Inequality, and Opportunity, the gentlelady from California, Ms. Lee.
Thank you very much. Let me thank our ranking member for yielding, but also for your long-term and long-standing commitment to child nutrition programs and to our nation's children. And I just have to say to Mr. Takano, I'm not happy at all. And I don't think many of us are happy at what is taking place with regard to this Improving Child Nutrition and Education Act and what is happening to our children, who many go to bed hungry at night. So thank you very much for your leadership. And let me just say to Mr. Scott, who is our ranking member, it is very important that we recognize your leadership and know that you're on this committee fighting each and every day to make sure that this reauthorization bill, which would take food out of the mouths of American school children, does not do that. And so thank you for your fight on the committee. Let me say just a couple of things with regard to H.R. 5003. It would turn the clock back on years of progress and prevent children from eating healthy meals every day. This Republican child nutrition bill would roll back critical evidence-based nutrition standards made in the 2010 reauthorization bill, which we were very actively involved with. Sadly, but unsurprisingly, it would also deny eligible children access to the free or reduced price school meals program. And it would slash funding for summer electronic benefits transfer. I just have to say, as a young single mother on public assistance and food stamps, I don't know what I would have done had my children not had school lunches. This was a bridge over troubled waters for me and my children, and I have to thank my government for that helping hand. But today, in 2016, this bill will roll back these programs, which means more hungry kids in our schools and in our neighborhoods. That's why several of us are sending a letter to the Education and Workforce Committee outlining our deep concerns with the changes to our child nutrition programs. I hope that everyone on our side of the aisle signs this important letter, and I hope that the majority will read it carefully. It lays out some of the basic problems in this bill, and we want to make sure that everyone on the committee and this entire body understands the impact of what this will cause. When we take away access to these meals, we jeopardize children's health, their educational attainment, and really their future. We know that children who have access to healthy meals are more likely to do well in school, have decreased behavioral problems, and come to class ready to learn. That's what we should want for all of our children. For the children growing up in high poverty neighborhoods and who lack equal access to healthy meals, these school meals really are a lifeline. And we're not just talking about a few students. The numbers are clear. More than 15.3 million children are living in insecure households. Let me say that again. More than 15 million kids are at risk of going to bed hungry every night in America, in the richest and most powerful country in the world. We also know that childhood hunger is far from colorblind. Children of color are disproportionately affected by hunger every day. For example, in 2014, 1 in 3 African American children and 1 in 4 Latino children, they were food insecure. And for children who lived in rural communities, food insecurity is coupled with other barriers like lack of access to transportation to get to summer feeding sites. More than 17% of rural households, that's 3.3 million households, are food insecure. Child hunger and the lack of nutritious food is a problem that affects every child in every zip code. It's endemic in our country, in rural, urban, and suburban schools. Every member of Congress has constituents who are hungry. Really, this should be a priority for all of us. I've seen the impact of food insecurity in my own community in Oakland, California, where 1 in 4 children at the Oakland Unified School District, they do not have access to affordable, nutritious food. These families are forced to make impossible choices to feed their children, especially during the summer months when school is closed. These families are making decisions every day between food and medicine, food and rent, or food and paying the electric bill. Mr. Speaker, we need real solutions to these very real problems. Let me just mention my legislation, the Half in 10 Act, H.R. 258. That would develop a national strategy to cut poverty in half over the next decade. That's more than 23 million Americans lifted out of poverty and into the middle class in just the next 10 years. This bill that we're talking about tonight goes just the opposite way. Surely we can all recognize that ensuring healthy meals for American children, that's the first step in this ongoing war on poverty. It should not be a partisan issue. Feeding hungry kids, that's a moral imperative. So let's put our children first. Let's strengthen our child nutrition programs rather than cut them. Our children deserve the security of knowing where their next meal is coming from. That's just basic. It's a basic American value. So thank you, Congressman Scott, for your leadership, and thank you for yielding.
Well, thank you. Thank you, and thank you for all of your hard work on the task force. Mr. Speaker, I now yield to a member who has been fighting for children as a member of the state legislature, a member of Los Angeles City Council, and now as a member of Congress, the gentleman from California, Mr. Cardenas.
Thank you very much, Congressman Scott, for working so hard and tirelessly to fight for those young little voices and those families that need food in their children's stomachs every single day. It's a tireless battle, and once again today we're trying to make people aware of the disingenuous, misguided efforts that are in this bill. I rise today to express concern over harmful provisions included in the so-called Improving Child Nutrition and Education Act of 2016. In 2014, more than 17 million American households were at risk of going without having food, including 3.7 million households with American children. We should make every effort possible to help American children access the proper nutrition that is vital to their growth, development, and success in school and beyond. The provisions outlined in this bill are doing just the opposite by tampering with programs that have been working well, such as the community eligibility provision, the process that ensures that meals can be served to American children in schools. The provisions in this bill will cause too many American children, especially low-income children, to lose access to these vital programs and to have healthier meals. The community eligibility provision allows high-poverty school districts to offer universal school meals to all students. This bill raises bureaucratic red tape. It will only lead to fewer schools qualifying for the program and more low-income American children going hungry every single day. Why add burdensome paperwork on school districts and each and every family in them? Instead, Congress should focus on improving and expanding direct certification, an approach that has been shown to improve program integrity. What this bill should be doing is addressing the barriers faced by eligible families who are currently not even accessing the benefits of the results of these programs because of the lack of awareness. This bill will freeze the progress that we have made on reducing the intake of salts for American children in their food diets. It would allow junk food to be an acceptable snack, which would undermine our children's health and their entire future. We must do more to improve school nutrition, attack undernourishment, and combat hunger for millions of American children, because otherwise we are robbing them of the opportunity to reach their full potential, both physically and academically. Once again, I want to thank my colleague from the great state of Virginia for all the wonderful work that you've been doing and for being so tireless in your effort to make sure that the voices of these families and these children are heard, not only in the Education Committee, but beyond. So thank you for bringing the attention to this to the floor, and I'm glad to be a partner in this effort. Thank you, and I yield back.
Thank you very much for your hard work, too. Mr. Speaker, reauthorization is an opportunity to improve legislation. Unfortunately, the pending Republican bill reduces nutrition standards and kicks kids off the school meal programs. Instead, we should be improving the program and expanding the child nutrition and the school lunch programs. And I thank my colleagues for saying why this is so important. I yield back the balance of my time.